Hello, my name is Mr. Nick Roeck. I'm a consultant orthopaedic surgeon working at Hatfield Hospital. A hip arthroscopy is a surgical procedure in which an arthroscope or camera is put inside the hip joint. The main reason it is undertaken is to carry out treatments for a condition arising in the hips of younger adults called femoroacetabular impingement. This is a condition in which the shape of the ball or the socket are mismatched, usually due to bony spurs that are formed during adolescence. Over a long period of time, these spurs can come into contact or impinge, which leads to pain. This condition most commonly affects younger adults, particularly those undertaking sport. If the condition is severe enough, damage can develop on the edge of the hip socket or to the cartilage ring around the hip called the labrum. This can start to cause deep groin or hip pain, which is often worse after activity. Some patients develop stiffness in the joint and have to stop physical activity. The condition can be mistaken for other causes, but should be considered in any young adult with persisting groin pain. For less severe cases, it may be possible to manage the symptoms with simple painkillers and anti-inflammatory medication, coupled with physiotherapy and modification of activity. If symptoms persist or become severe, then hip arthroscopy can be offered with a view to removing the bony impinging prominence. The most up-to-date scientific evidence suggests that surgery does improve pain more than other measures. The hospital stay is less than 24 hours. Usually patients can weight bear initially, or they may need crutches for a couple of weeks. Post-operative rehabilitation with a physiotherapist is very important to ensure muscles are strengthened and to minimise the post-operative stiffness. This can be needed for 2 to 3 months after the surgery. Most patients will derive pain relief and improved function after the surgery. However, not all patients get complete symptom relief or the ability to return to high-level sport. The bony spurs don't reform, so as such the condition doesn't recur. However, some patients can get recurrent symptoms. This can be due to scarring and stiffness arising from the surgery. In some patients, damage to the hip joint may have occurred prior to the surgery from the condition, and so arthritic symptoms can start to progress. Patients can come following a GP referral or book in from consultation directly by calling Hatfield Hospital. This condition is commonly picked up by physiotherapists treating patients who have developed pain after sport or physical activity, and they will often advise patients to seek medical advice.